the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today on the show, we have Karen Koenig. She is an eating disorder therapist. Her KevinMD article is titled 5 Tips for Treating High Weight Patients. Karen, welcome to the show.
Thank you for having me.
We'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
Well, and professionally, I'm an eating disorders therapist because I'm half a lifetime. I'm 75, recovered from a binge eating disorder and chronic dieting, which is also an eating disorder. I'm a clinical social worker, and I also have a master's in education.
All right. So tell me about the role of psychotherapy when it comes to treating eating disorders.
Well, there's a range of eating disorders from anorexia, bulimia, overeating, which is what I treat. So psychotherapy is different for each of them. But because what we do and feel is based on what we think, we talk to clients about what are your beliefs about food, eating, your body. Mainly what I find is people have a lot of trauma, family dysfunction, and use food as a coping mechanism. Psychotherapy is key to treating eating disorders because very often clients have eating dysfunctional families, or they have trauma and they use food or over focus on weight as a way of coping. So without psychotherapy, you're just treating the behavior. You're not really treating the root cause.
So what are some misperceptions about eating disorders that you've experienced? You've been doing this, I assume, for a long time now. So what are some common misperceptions about eating disorders that you would like to help clear up?
Well, if I had my way, I wouldn't even call them eating disorders. I certainly would call them problems on the mental health continuum in how people relate to food, to their bodies, their life skills, their intrapsychic problems. So if we're not treating the mental health issues, we're just not treating it.
All right. So let's talk about your KevinMD article. It's titled 5 Tips for Treating High Weight Patients. Now, for those who didn't get a chance to read your article, just walk my audience through it, share the story of why you decided to write it.
Yes. And a perfect example is a client of mine who kept having stomach problems. She is higher weight and she didn't go to the doctor. She finally did. She called me from the hospital. I'm having hernia surgery. She didn't want to go because there's 5 reasons. She didn't feel listened to. She didn't feel heard. She'd be talking to the doctor and the doctor would be, typing notes. And she understands the pressure. I do too. But especially people of higher weight really need that eye contact. They want their health concerns addressed. Surprise, they know they're higher weight. Most of them have dieted, lost 100-pound gain. This is the bane of their existence, their eating and their weight. They're coming for other problems, which may or may not be weight related. I weigh about 95 and I have knee problems. Obviously, for some people, weight is a problem for their knees, their back, other things. They fear being judged. Biggest issue. And when we look at studies, I wrote a book with an MD helping patients outsmart overeating. The studies that we have in the book show that there's a tremendous bias in the healthcare industry against higher weight people, as if 1, they don't know they're higher weight, and 2, they don't care. They don't want to be told to be put on a diet. We've known since the 1980s. 95% of people who diet and lose weight regain it. 90% regain even more. They have diet. They're not there to talk about their weight for the most part, or their eating. And last, they want to be seen as a whole person, not just a fat, higher weight person. And they really want what everybody else wants when they go to their doctor.
So what are some tips that you give in the exam room to clinicians when we deal with higher weight patients and they come up with some of these fears and concerns? What are some tips that you could share with the clinicians?
I'll tell you, the biggest one is for every clinician to examine themselves and their beliefs. I have been in this industry for 35 years. I have been higher weight. I have been lower weight. I have my biases because I grew up in this country. So to own them and then make sure they don't get projected when you're with the patient. That is the biggest thing to get through and get past, because yes, most clinicians, do you have a bias? Are you prejudiced against Black people? Oh, no, I'm not prejudiced. You have a prejudice against fat people? Oh, no. But most of us do, because we can't help it. So that would really be key. And then make a special effort to focus on the problem, not mention weight or eating, unless the client wants to talk about it, of course, the patient, to ask how they can be of help, to maintain the eye contact, smile, and get to know the person as a whole person. So, I think that really works, because people are training MDs, people in my industry, but they're MDs, are training clinicians to focus differently on higher weight. And, we know you're there wanting to help.
Mm-hmm.
So come to us and ask how we can be different.
Let's talk about that self-examination for these. I think what you're referring to is implicit biases. So what exactly would that look like? So if a clinician wanted to self-examine for potential implicit biases against higher weight patients, what exactly would that look like? What kind of questions should they ask themselves?
I would start with the same as we do as psychotherapists. What are your beliefs? Do you believe that obesity is an illness? Do you know what most people of higher weight want to be called? When you see someone of higher weight, what do you think of them? What do you associate? Do you think that they're lazy? They don't care about themselves? So I would ask a whole range of questions for them. And I'm sure there's questionnaires out there to be asked. Again, referring to my book, we have those kinds of questions in. So people who want to can rethink how they think about higher weight people. And if you notice, it's longer, I say higher weight or high weight, low weight, because that's value neutral. So those are the questions I would ask. And then I would ask, do I have trouble even thinking and talking about this? Does it make me uncomfortable? It depends on the caregiver, the clinician's weight and eating issues. How does that compound the issue and complicate it, which it does.
We're talking to Karen Koenig. She's an eating disorder therapist. Her KevinMD article is titled 5 Tips for Treating High Weight Patients. Karen, what are some of your take-home messages that you want to leave with the KevinMD audience?
That you're not bad because you have biases against higher weight. This is what our culture tells us constantly. So the first thing is to not feel shame about it, to be open to changing, and to look for books and articles that can help you, and it will make a huge difference to you and to your patients.
Karen, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thanks for having me. I appreciate it.